Great. With that, we'll jump right to our next speaker. I'd like to welcome Sasha Smith from Children's National Hospital, who will be presenting on an examination of pediatric health systems health literacy environment. Sasha, let's begin.
Hi, thank you so much for having me. My name is Sasha Smith. I'm a community health education specialist in the office of the Child Health Advocacy Institute at Children's National. I'm so happy to be here presenting our research on behalf of my colleagues at the CHI and nursing. Next slide. So a little bit of background on health literacy. It's defined by the U.S. Department of Health and Human Services as the ability to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So as you can imagine, this touches every part of somebody's life. It affects the ability to take medication correctly, to access appropriate care, to understand vaccine schedules. And so a Children's National Multidisciplinary Committee, knowing this, decided to take on the task of evaluating our own health literacy environment. What are we doing within the walls of our own hospital to really foster an environment in which effective communication is occurring? Additionally, the DC Health Matters Collaborative, which Children's National is a member of, along with other hospitals and health systems in the city, identified health literacy as one of our 4 community health needs priorities. So this means that this research is being driven directly by our community. They stated that this should be a priority of the health systems in the city. Next. So some objectives of this work: we wanted to engage hospital leadership to make health literacy a priority. We wanted to make it integral to our mission, structure, and operations. We wanted to assess hospital employees on their knowledge, behaviors, and health literacy practices. What are they doing when they are communicating with our patients and families? And we wanted to identify systems and policy approaches to address health literacy. Next. So what we did, between September 2019 and May 2020, we launched a qualitative research project to gain insight into the health literacy perspectives, experiences of our hospital employees. We really wanted to get a clear picture of what they are doing when they are in the clinic, the emergency room, the well-child visits, when they are communicating health information to our patients and families. So we performed 10 key informant interviews with our internal health literacy and safety experts. We really wanted to engage the people at our health system that are making these safety-based policies. We performed 7 focus groups with 28 attendees. These really branched a large variety of providers and other health professionals, from physicians to nurses to our medical language interpreters, our parent navigators, our child life specialists. We also launched a system-wide survey, which yielded 174 responses. This survey asked about people's own personal communication practices. Are they using teachback? Are they encouraging questions? Are they using models? But we also asked about what they were seeing in their department as a whole. Are these practices institutionalized, or is it something that they're doing on an individual basis? Next. So this is a breakdown of the employees that we reached through this work. We yielded 212 total responses. That has an asterisk next to it because we don't know for sure if it was 212 total employees. Because the survey was anonymous, there is no way of knowing if somebody participated in a focus group and the survey. But we reached 91 physicians, 54 nurses, and 67 other clinical and non-clinical staff. Again, people like our medical language interpreters, our child life specialists, and our parent navigators. Next. So we identified some common themes through this work. People frequently stated wishing to have more time to spend with patients. The short time in a well-child visit is not always the best time to perform good health education. Additionally, the stress of an ER visit, the time at discharge, is not necessarily a great time to be doing intensive patient education. It can be hard to communicate effectively in that environment. People wished for more streamlined discharge materials. Anybody who has ever been discharged from a hospital knows that you're often handed a big packet of information, and our physicians and other clinicians wished that they had the ability to hand patients and families something in bullet points or that's only 1 or 2 pages. They wished for more models and other visual materials, particularly things like pictograms to illustrate how to properly take medication. They wished for a bank of pre-vetted information to pull information from. for things like, common conditions or how to use an inhaler. Physicians and nurses stated that they're frequently forced to Google things on the fly to provide to patients and families, and having a bank of pre-vetted information that is already written in plain language, that is available in a variety of languages, would be very helpful. They also stated that the health literacy status of a patient and family is very difficult to discern when you just walk into a room. You can't tell by looking at somebody what they are or are not going to understand. Next. So knowing what we know now, we hope to move forward by engaging our hospital leadership to implement some of the suggestions of our providers. We also found that employees believe that this is important, that they themselves are seeking more information about health literacy, knowledge, and skills. So we hope that this will make instituting these kind of exchanges easier. Next. So next steps moving forward, we hope to use this data and utilize the 10 attributes of a health literate organization to institutionalize these best practices and continue to engage our leadership. Next. So here's our poster as a whole. Next. And any questions?
Great, thank you. We appreciate sharing this. And it's interesting that timing-wise, it's Health Literacy Month, so.
It is. Happy Health Literacy Month, everybody.
Yeah, good timing on that. We could have made a whole session out of this, I think. You mentioned some of the typical practices, and I just wanted to, one of the questions that came in was about teach back. I think that's a common method that a lot of folks use. Is that something that your clinicians use as they're having those conversations? One of the things that they do, and are there any other sort of mechanisms that they've started that perhaps you didn't highlight as much in the talk that you think are worth mentioning?
Yeah, so we asked about teach back specifically in that survey that we got 174 responses from. People overwhelmingly said that they are personally using teachback, but they didn't see teachback institutionalized in their own department. So while they themselves felt that they understood the practice, they didn't necessarily see that reflected in the institution as a whole. They did not receive training on it in any of their children's national specific orientations, nor was it something that was demanded by their supervisors. So while they themselves understand it, it is something that we hope to institutionalize and formalize as a practice. Makes sense.
Someone asked about the materials, and it's interesting. I was on a phone call with somebody the other day. They might even be on this session. I can't recall, unfortunately, who it was, and they were talking about actually not having things like visuals readily available, and so sort of how tough it was to get those. As you've been developing your library, have you found that you mentioned it? Is it something that having visuals and various reading levels has been things that you've had to develop on your own more? You've been able to do a mix? You know, are your clinical folks developing their own and putting them in the library? How does that work?
So our clinical folks are often developing their own, but then they're not, you know, it's hard to put them in a library. It's hard. We don't have a bank of information that clinicians can pull from now, which is something that we'd love to have in the future. So many physicians mentioned to me that they draw things on the fly, which is not something that I had imagined when I first took on this research, that they are like literally ripping off the corner of the paper of the discharge materials and drawing what it is they need to draw. So having things that they can pull from that, you know, are pre-vetted, that they're correct, that they're in plain language, that we have resources for a variety of common conditions is something that I would love to see in the future.
That's interesting. Even visual demonstrations. I can recall somebody one time talking about a torn meniscus, sort of taking a piece of paper and sort of demonstrating the difference between a little tear and a big tear, yep. You know, in a way that was sort of visual, coupled with sort of the teaching with it. So that's creative on the fly thinking, I think, is also useful.
Our providers understand it's important. It's then how we can institutionalize it and support all of them in making this as easy as possible. Right.
Well, and once somebody comes up with something that seems effective, that others can learn what that is and then take advantage of it. That's why I think that, you know, the thought about the bank and like how you build that up is something that's interesting. Do you have, somebody made a note about different platforms used for patient education. Are there lots of different ones, or is there one particular platform that Children's uses?
Yeah, so I see that my colleague Wayne Neal posted that in the chat. Wayne Neal is one of our internal health literacy experts. She is a genius. She's their go-to in the system for all of this. She is a co-author on this study. So we have several platforms that are used for patient education, and choosing one has been a challenge. It's also hard in a health system as big as ours. What people are doing in the ER is likely different than what people are doing in our primary care clinics. So making sure that everybody is aware of the resources that are available to them, and that we're pushing those out in a way that is accessible to our providers who are busy people. They don't always have the time to be doing all of this research on their own. I believe that it's our job as public health professionals to then support them the best we can.
Right, makes sense. I'm going to try to squeeze one more in the time we have for you. And this is such a big endeavor to do this, and to your point, do it in a way that actually spreads the knowledge and the resources across the organization. If a hospital is trying to figure this out, what do you think the best place to start is?
So we have based all of our work off of those 10 attributes of a health literate organization. They are cited in this study that will go out, so you can click on the link that's here, or you can just Google it. And it is a really comprehensive list of what a health literate organization should be doing. So from things like making sure that the navigation in your hospital makes sense, to your website, is your billing clear, to all of your physicians encouraging questions. It goes through line by line, from technology to navigation to written communication to verbal communication. And we've been using that really as our map, as our North Star as we move forward in institutionalizing these practices.
Great, thanks. We appreciate you sharing all of this work today.
Thank you.
Very educational, as were the other sessions.